sudden swelling of the leg, redness, fever, and oozing. Cellulitis is a dreaded complication of lymphedema, what in common language called red legs. The good news is that the integrative medicine approach has treatments which can reduce infections and patients can have a very good life. I am going to explain you how this is caused and how lymphedema patients can prevent the occurring of repeated cellulitis. Cellulitis is the deep tissue infection. It's an infection underneath the skin or in the deeper parts of the skin. Especially in lymphedema, when it happens, it can become very complicated. The infection can get into the blood and patients can get what is called sepsis. They will present with sudden fever, chills, rigors, and they have a toxic feeling. They are unable to walk, get up from the bed. Their legs are very painful and sometimes it starts oozing. They need to meet the doctor immediately. And as the time passes, in few hours, they will get a rising temperature, making it kind of a medical emergency. So this is a common presentation of cellulitis or what is known as filarial fever. Many lymphedema patients, especially chronic lymphedema patients, have comorbidities. That is, they have associated other diseases. Like they may have diabetes, they may have heart problems, they may have blood pressure, high blood pressure, they may have thyroid problems, or their blood levels may be low, what is called anemia, and sometimes they might have a kidney problem. Whenever these associated diseases are there, it's very highly likely that these patients' cellulitis will get more complicated. So they need an immediate attention. So lymphedema patients should know how to prevent the occurrence of cellulitis. If we educate the patients that there are some triggers which can give rise to cellulitis, white spots in between the toes or fingers called intertrigo, there may be some wounds or ulcers, there may be tiny folliculitis or the tiny pus around the hair, or they may have a oozing eczema, pruritus, or they may have what is called nail bed infection. These are the things which harbor bacteria, most probably staphylococcus, and that can enter into the lymphadematous skin and cause cellulitis. And when the limb size increases, there can be breaches on the skin, what in our technical term call barrier function, which is the function which prevents any toxins or bacteria entering the skin gets damaged or failed, barrier function gets failed, and these are the things which cause cellulitis. So the patients have to always be vigilant that these are the 5-6 things which should not happen on their leg. So they have to always, after bath or at bedtime, they have to look at their leg very carefully. If their leg is very big, somebody at home can very carefully look into their leg. They can open their toes and see if there's white thing is there. Put a light on their limb and see if there's some injury while walking, if there's small ulcer or excoriation. And then for that they have to talk to the doctor, and whatever the doctor prescribes, and they have to apply that, and that will prevent cellulitis.
Prevention starts with these key strategies. Skin care. Keep the skin clean, moisturized and free of cracks to reduce bacterial entry. Hygiene practices. Use antiseptic washes and dry thoroughly after bathing. Regular nail care. Avoid cutting the skin around nails to prevent bacterial access. Avoid injuries. Wear protective clothing to prevent cuts or scrapes.
When taking rest or going to bed, they have to put their foot end elevated slightly, keeping couple of pillows under their leg. To prevent cellulitis and prevent the recurrent attacks of cellulitis and lead a very, very normal life with lymphedema, it is important that patient maintain the skin hygiene with the regular wash with soap and water, and prevention of infection control using LFA oil massage. And then good hygiene of the environment, their room, their bed, and their length. At IAD, we are here to guide you in every step in the prevention of cellulitis.